Greetings. I want to talk about jaundice. Now, let me tell you, before I start, let me tell you what can happen, how bad jaundice can be, how it can affect a baby. Have you heard of cerebral palsy before? Cerebral palsy is a condition where the child's brain there's some damage to the child's brain. And because of that, the child is not able to talk well, and the child is not able to move well. The child becomes dependent throughout life. And that's cerebral palsy. There's a word we call it in our local parlance, but it is abusive, so I don't want to call it. Now, these are the two things that can cause cerebral palsy in our environment. Number one is when the baby is born and is not able to cry. The baby did not cry immediately, so that can cause cerebral palsy. And number two is jaundice, neonatal jaundice or jaundice in the newborn. And some of these children, when they were born, they cried at birth normally, but during the course of their development, they developed jaundice, and the jaundice was not treated well. The parents did not go to the hospital on time, so they developed cerebral palsy. That is the complication that arises from jaundice. Now, what is jaundice? Jaundice is a medical condition in which the eyes and the skin of the baby turns yellow. Right? It's yellowness of the eyes is simply jaundice. And the truth is that it's not only the eyes that are yellow, the skin are also yellow, the palm are yellow, and the soles are yellow. The soles of the feet are yellow. So it's just yellowish discoloration of the eyes and the skin. Mm? And the more yellow the body become, the more severe the jaundice is. There's the one that you just see on the eyes only. There's the one that you see on all the skin, all parts of the body. Now, how do you know that your child has jaundice? How do you know that your child has jaundice? You know, he gives himself away. He gives himself away. Eh? The number one way you will know is the eyes, it turns yellow, or the skin. You just notice that the eyes and the skin is turning yellow. Number two is that the child may have, you notice that the child is not sucking well again. The child that used to suck very well, the child is no longer sucking very well again. And the urine of the child will be very yellow. When the child urinates, the urine will be very yellow. Hmm? Those are the signs of jaundice. And another thing, this stool of a child is actually yellow. Is actually yellow. Now, when the child passes to this stool look like chalk, and it's a little look like milk or a little whitish. Those are the signs and symptoms of jaundice. Eh? Now, you know what is jaundice? What causes jaundice? I know a lot of there are a lot of news, a lot of different stories about jaundice is from. Some say it's because of the food the woman eats. So we tell you that if the woman drink cold water, the baby will develop jaundice. So we tell you the woman ate some certain food, the child will develop jaundice when the baby is born. You understand? That is if the pregnant woman now. But the truth is, none of this cause jaundice. Now, there is a pigment. What makes the baby's body yellow and the eyes yellow is called bilirubin. If you have killed a fowl before, we're in the festive period now. If you have killed a fowl before, there is a part of the fowl that they will tell you that if it breaks, if you burst it and the what is inside touches other part of the chicken, the chicken will become very bitter. Eh? That is called bile or bilirubin. That is called bile. That part of the chicken is what they are trying to tell you not to burst is called the gallbladder, right? So when you burst it and it spills on the chicken becomes very bitter. So same way we have bile and bilirubin in our body. Hmm? You understand? So that is what is causing when it's too much in our body, in the child's body. That is what is making the baby's eyes yellow, the body yellow, the feet yellow, the palm yellow. I hope you understand this. Now, these are the things that causes jaundice. When a child is born, if there is a problem with the liver, because it's the liver that is responsible for breaking down this bilirubin, so that we can excrete it through our stool. Is the liver. Now, if there's a problem with the liver, most times the reason for jaundice in children is when there's a problem with the liver. And most of the time, the problem with the liver arises is congenital. The child was born with it. So there's a condition called biliary atresia, where what is supposed to be carrying bile through the liver is blocked. The child was born like that, or it was not developed. So the child bile accumulates in the child's body and the eyes become yellow. Biliary atresia. Number two is there are some women that are rhesus negative. Their husbands are rhesus positive. Now, when they get pregnant, the immune system of the woman starts fighting against the immune system of the child because it starts seeing the child as foreign. So in the process, it starts destroying the red blood cell of the child, and bile will now be formed. Because bile is actually formed from the breakdown of a red blood cell. Bile will now be formed. So rhesus incompatibility, when your blood type does not match, the woman's blood type does not match that of the baby, it can cause jaundice. I'm trying to break it down in such a way that it will be easy for you to understand. It can cause jaundice. That's why you must make sure that your blood type, when you are rhesus negative and your husband is rhesus positive, you must go and collect that injection called Rogan. Another reason you may have your child may have jaundice is malaria. Malaria is very common in Africa and Nigeria. Malaria causes breakdown of red blood cells, so malaria can cause jaundice in children. Any form of infection, can cause the breakdown of red blood cell. And when the red blood cell is being broken down, it can cause jaundice because it will be broken down in such a way that the liver will not be able to mop it up. And when this happens, it can cause jaundice. It's called prehepatic jaundice. Jaundice can be prehepatic, that is before the liver. Hepatic, that is the problem is arising from the liver. And posthepatic, that means the problem is arising from after the liver. Now, if there's any problem with the gallbladder, whereby it's stored, it can also cause jaundice in children. Now, there are some women, when a child is born, they start prescribing all sorts of drugs for the child. If the child is sick, they just give the child anything, especially paracetamol. And you know paracetamol can damage the liver if the dose is too much. It causes chemical hepatitis. And when there is a problem with the liver, you know jaundice will develop. And so those are the things: drugs, infection. Some of you, when your water broke before you deliver, your water will break and you still be at home. It's later you will now go. Maybe you will now go to the hospital. And by that time, infection has spread through that broken water to your baby, and your baby will become sick. Your baby will develop neonatal jaundice. Yes, neonatal sepsis. And that infection can break down red blood cell, and your baby will develop jaundice. Those are the common causes. I mentioned malaria, I mentioned liver, biliary, congenital problem. There are also some genetic problems too that can cause jaundice in children. I don't want to mention their name because it does not concern you because the names are too big. I mentioned infection. I mentioned sepsis, like infection from sepsis, malaria, liver diseases like biliary atresia, gallbladder problem. When the gallbladder is not able to send send bile to other parts of to the intestine, so it flows back into the blood. Those are the causes of jaundice. So all those other stories you are hearing that jaundice is caused by what you eat, food, because you drank water, cold water when you were pregnant. That's why your baby developed jaundice. Not true. You understand? Now, I also mention your blood type. When your blood type it does not match with your baby can develop jaundice as a woman. Now, how is jaundice treated? Now, that one you will now go and put the child in the sun and say the sun will help break down the bilirubin. It's not true. It does not work. Sometimes some of these jaundice will go away on their own. But I don't want you to wait for it to go. When you notice that your child has jaundice, go to the hospital. They will put your child under incubator with light called phototherapy. That phototherapy, you know what it does? It will help break down the bilirubin of the excessive bilirubin in the child's body, and so that your child will be able to excrete them through the stool. You know your child's liver is also not well developed after delivery, so they are prone to jaundice. Another thing is that if that phototherapy do not work, they'll do what they call exchange blood transfusion for your child. Exchange blood transfusion, where blood will be removed from the child. The jaundice blood will be removed from the child and fresh blood will be given to the baby. And most times, this blood is freshly donated by either, especially the father or any other relative. If you have any question, please let me know. My time is up. Thank you. I don't forget my YouTube channel. Bye bye.